helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Raquel Wolf. She's a nurse practitioner with Revive of Colorado. Great to see you, Raquel.
Thank you.
And we're in your place, right?
Yes, in the lobby, and we're at 218 East Cheyenne Mountain Boulevard.
Well, great. We came on a field trip today to Revive, and I want to ask you today about a specific therapy, PRP. I've read more about this. I've heard more about this. Explain to me what it is and how it can be used.
It is platelet-rich plasma,
Okay.
and it is just a simple procedure where we take your blood, we spin it down, we grab a whole bunch of platelets, and we concentrate either the area of trauma or injury with that high concentration, and advanced healing occurs.
So how does that happen? What's the significance of the platelets? And if I'm taking blood from one part of my body and just putting it back in another, what's happening in between?
Well, platelets, we have platelets that circulate in our body naturally.
Okay.
But when you take a high concentration, they're kind of our first responders. So when you cut yourself, they have a whole immune response, and there's just a cascade of events. So when you concentrate that a whole bunch of platelets in the area of injury, it kind of tells the body, hey, focus on this area, and a shorter recovery time.
Makes sense. So you're taking something that your body already has, sort of harnessing the power of it and concentrating it in that one area.
Yes.
Okay, I get it now. A lot of sense. So how do you know if this is something that might work for you? Is it just a general therapy? Is it something on a specific type of injury?
It works really well with short term. We have a lot of athletes in Colorado Springs, and they want to get back out there as fast as possible. They've been training for a long time. So typically any of your partial tears in any of your joints, knees, hips, shoulders, rotator cuff tear, ACL tear, the labrum tear in the hip, it is a great way to speed up that recovery time.
And do some people try this perhaps before surgery? Is it something you can give it trying to stop having to have a major procedure perhaps?
Well, surgery, there's always a time for surgery.
Okay.
These short-term injuries where the body will probably naturally heal it eventually.
Gotcha.
The theory is just to more speed that recovery time up.
Okay, and what is the process like? Do I have to come on one day and have my blood drawn and come back another, or how does it work?
No, typically, a patient will call in and we'll either get the imaging that they've already had or get them imaging of the area.
So the imaging is important?
Yes, imaging is very important.
Okay.
And then come in and we have a consult and talk about it, and then we can draw the blood here. It takes about 15 minutes, spin it down, and about 15 minutes for the injection.
Oh, so it all happens in one process?
It can, yes.
And is it tons and tons of blood? How much blood are you taking? I know some people don't like that.
Well, it's 60 milliliters, which is equivalent to about a fourth cup.
Okay, so not a huge amount.
No, not much.
Got it. And then what about the recovery? You said, it decreases the time of recovery in general, but what do I have to do for the first few days afterwards?
Typically, I like 48 hours of downtime, and then slowly increasing over 2 weeks to get back to normal activity. Physical therapy is highly recommended about the 2-week mark.
Okay. And if people are concerned about, is this an appropriate therapy or not, is that something they can discuss with you?
Absolutely, absolutely. I'll look over the imaging, we'll look over, what their goals are for the year, and address pain and create a good care plan for them.
And is it something that's done repetitively, or you do it once, or does that just vary depending on the person's response?
Exactly. It is definitely depending on the type of injury, how long they've had it, and again, what their goals are.
Okay, so the first step is clearly to just give a call and come on in.
Yes.
Fantastic. Well, thanks for inviting us here today, and thanks for teaching us about PRP. We appreciate it.
Thank you.
Thanks for joining me today and every day. I'm your host, Jen Lennon, for Moms Every Day.